So that brings us to spine injections. What is the role for injections? If you consider the treatments that are available sort of as a pyramid, with conservative treatments at the bottom of the pyramid, those are the ones that most patients are going to get better on their own. You might as well manage them conservatively with NSAIDs, activity modification, watchful waiting. And then at the top is the surgical option. That's the expensive one. On average, about 300, like I mentioned, 300,000 surgeries a year, $34,000 Medicare average for a spine surgery. The goal of spine injections may be somewhere between the two. But where do spine injections really help? Well, they can reduce pain in some patients. They can permit some patients to move down to physical therapy or more conservative management. In other patients, it may help to identify those more likely to benefit from surgery. One of the things that we like to say about spine injections is they really permit direct coupling of the anatomy and the clinical symptoms. So if I see an abnormal finding on an MRI, I'm not sure what that means. But if I'm able to inject, I can test a hypothesis as to whether or not that's causing the patient's pain. These injections are very low risk. There's a small risk of infection, but less than 1%. They're positive outcomes as long as it's done correctly in the correct group of patients. And the cost is considerably lower than surgery, which, as I mentioned, about $34,000 each surgery. So in general, you consider two roles for spine injection, both of which we do routinely in our practice, I would say. And the first injection can be used to sort through many of the potential causes of pain. And if a patient has a good response to blockade, or say a compressed nerve, then we can be more confident that what we're seeing is causing the pain. The other role is therapeutic. So there are many patients who have severe pain that doesn't respond to conservative treatment. They may not want surgery. They may not be eligible for surgery because of other comorbidities. And in this group, the goal of injection is therapeutic, to make the pain go away, at least for some period of time.